public health facilities in Lagos. Sarah Ayeku, TVC News, Lagos.
And in Ogun State, the government has confirmed 9 cases of cholera out of the 25 suspected cases in the state, with 1 death recorded. TVC News' Kazim Olowe reports.
As cholera cases spread to more than 30 states in the country, Ogun State government has confirmed 9 cases out of the 25 suspected cases, with 1 death. The cases, according to the Commissioner for Health in Ogun State, spread across 7 local government areas, which are Ado-Odo-Ota, Remo North, Odeda, Shagamu, Ijebu North, Iwekuru, and Obafemi-Owode. The Commissioner added that 8 out of the 9 confirmed cases have travel history to Lagos, and 6 of them were reported to have taken tiger nut drink while in Lagos. She said the state has put measures in place to put the spread under control.
As of today, the 24th of June 2024, Ogun State has recorded 25 suspected cases and in 7 LGAs. The initial 8 cases actually originated, the first 8 cases originated from Lagos State, which is the reported epicenter for the cholera outbreak in Nigeria at present. And it states that, and it shares borders with 4 of our local governments.
The Commissioner warned residents to be conscious of what they eat or drink and appealed to people to create awareness among their families. The Commissioner for Environment also highlighted what the state is doing to reduce the spread and ensure the environment is clean and safe for the people.
The State Epidemiology Unit is on high alert. All LGA disease surveillance and notification officers have all intensified their surveillance across all 20 LGAs. Our private health facilities and citizens have been sensitized to heighten their index of suspicion and report any suspicious case immediately.
We are all out now checking boreholes and water supply for especially those who are into commercial use of this water supply, and they can distribute this problem easily if they are extracting water.
Members of the public were also urged to ensure they take clean and safe water, preferably water supply through the State Water Corporation. They want school administrators to monitor their learners and ensure they screen whatever the vendors sell to them. Kazim Olowe, TVC News, Abeokuta.
Meanwhile, the Oyo State government has announced that it has identified 7 suspected cases in the state. The Commissioner for Health, Oluwaseremi Ajetunmobi, disclosed this while addressing newsmen in Ibadan, the Oyo State capital. And senior reporter Olaido Yewole has more in this report.
Nigeria is currently experiencing cholera outbreak, with the Nigeria Center for Disease Control and Prevention reporting over 1,528 suspected cases in 31 states. The main cause of the outbreak has been linked to contaminated water and poor sanitation, made worse by the rainy season, which can spread the disease through flooding and unsafe water sources. Following this development, Oyo State government says it has identified some suspected cases and they are under observation. The ministry also adds that it has implemented measures to contain the outbreak and prevent further spread.
So far, so good. God has blessed us in Oyo State. I told you before that before now, we have started preparing for this kind of emergency preparedness. And so far, so good. We have 7 suspected cases in Oyo State as at this morning. And out of these 7 suspected cases, 5 had been declared negative. We are awaiting the culture of 2 other suspects. As I'm talking to you, we don't have any positive case of cholera.
Regarding the ongoing strike by the health workers in Oyo State, the commissioner assured that Governor Makinde is actively working to address the workers' demands and resolve the issue.
But it's just to tell you that before now, even before they declared their strike, the governor, the executive governor of Oyo State, Engineer Seyi Makinde, has tried his possible best to make sure that he puts might on the faces of workers. The salary is not being denied, but it's just that they want an increase. And part of this increase, everything has to be on deck because, just as you know now, the nurses are on strike too. and they are coming on strike, they cannot do for a part and neglect the other. Everything has to be taken together, so that, because if you do for a part and neglect the other, it's a vicious cycle. Other two will come and they say they are going on strike then. So he's trying his possible effort to make sure that everybody is happy.
The Oyo State government's move to contain the cholera outbreak and end the health workers' strike in the state is a major move towards ensuring that normalcy is maintained in the state health sector. Olaide Oyewole, TVC News, Ibadan.
And earlier, the Director General, Nigeria Center for Disease Control and Prevention, Dr. Jide Idris, says the outbreak of cholera is now a national emergency. The former Commissioner for Health, who spoke to TVC News, said vaccine cannot do it alone. Residents should be sensitized on keeping proper hygiene.
Cholera situation in the country now should be placed at high risk. There are 4 levels of risk. You have low, medium, high, and very high. It's suggested that we should activate the Incident Operation Center, National Operation Center for Cholera, so that we can effectively address this situation. The reason being that, having considered all the data available, there is still an increasing trend of suspected cases nationwide. We've seen more cases now in more states than we did in last year. The case fatality rate of cholera this year is about 3.5%, which is much higher than the recommended regional 1% for Nigeria. Cholera has to do with access to water, hygiene, personal hygiene, environmental hygiene, and environmental sanitation. And they suggested activation of this EOC, which we did this morning. We've appointed an incident manager who will coordinate all activities and work with different pillars drawn from different states.
In just a moment, we'll be speaking with the President, Association of Medical Laboratory Scientists of Nigeria and public health experts. He's standing by for us, but that'll be after the break. Now, still to come, Governor of Ogun State, Dapo Abiodun, emerges chairman of Southern Governors Forum, as Governor Charles Soludo is now the vice chairman. We'll have details of this and more when TVC News returns.
The Job Creation and MSME Clinics Secretariat coordinate invites operators in the MSME sector and the general public to the 6th National MSMEs Awards, scheduled for June 27, 2024 at the State House Banquet Hall, Presidential Villa, Abuja at 4 p.m. prompt. Special guest of honor, His Excellency President Bola Ahmed Tinubu, GCFR. Chief host, His Excellency Vice President Kashim Shettima, GCON. All guests are expected to be seated by 3:30 p.m. Announcer, Clemitola Adekule Johnson, MFR, Senior Special Assistant to the President on Job Creation and MSMEs.
Hey, big head. Oh, yeah, sorry. Where are you?
I'm at the bus stop.
Dinner is ready and mommy wants you to come home.
Come in as soon as I get a bus.
I will show you.
Junior, don't do that.
Sweetheart, no matter what you do, we show you love. So you can show more love to everyone.
Mom, how do you show more love to everyone? I will show you love.
Show some more love today with 4 more packs of your favorite Indomie noodles in Indomitable and Super Pack cartons. Also, each Indomitable pack is now 200 Naira, while Super Pack is now 350 Naira. So hurry now. Offer valid till stock lasts.
Thanks for staying with us on TVC News at 10. A reminder of our top stories. Lagos State government confirms 29 dead, 30 persons hospitalized as NCDC declares cholera outbreak a national emergency. Supporters of former local government chairman in Rivers State rally support for closure of council secretariats by the police. Outside Nigeria, 8 people dead after office building fire in Fayazino near Moscow, the Russian capital. Sports, Italy draw Croatia to reach knockout stage of the 2024 European Championship. We're staying on the outbreak of cholera in the country, which the NCDC has now placed on high risk and declared a national emergency. Let's talk about this with the National President, Association of Medical Laboratory Scientists of Nigeria, and a public health expert, Dr. Kasmir Fine. Good to have you join us.
Good evening, viewers. It's my pleasure to be here.
So, I mean, as you look at the different response across several states, what do you make of our response so far? And then the NCDC has also now placed it on high risk. What do you also make of that?
I would want to start quickly by commending the leadership of the Nigerian Center for Disease Control and Prevention. Of course, their response to outbreak has always been very top-notch. And the new HEMSman there, Dr. Jide Idris, is doing quite well by providing direction and making regulations which sits very well with the core mandate of the Nigerian Center for Disease Control. Having said that, I would also want to commend the health authorities in Lagos State. How I wish other states are up in arms and upbeat with the efforts to contain this particular outbreak. My worry about cholera is that we shouldn't be mesmerized the way we've become mesmerized lately by this outbreak. Recall that sometime November, December 2023, we had this outbreak ravage parts of Cross River, I think the Obobra area. It ravaged there, and I consider that the foci from where this infection had become, had become fulminant and spreading rapidly. You see, the worry is that in all that has been done so far and what NCDC is doing, we need to come up with a containment strategy and a preventive strategy that will help us exit the endemicity. It is not just describing it as very high and high risk. I think it is time for us to come with a roadmap of exiting the endemicity of cholera in Nigeria. Cholera
and Dr. Kasmir, apologies for jumping, but I just want to ask you, because you've talked about containment strategy. One of the things that the Lagos State Commissioner said, Commissioner for Health, Professor Akin Abayomi, said, is that, people are not presenting themselves in hospital while the case is still mild. What sort of community-based response should be activated to ensure that some of these cases are detected at a very early stage?
Well, we've looked everywhere from what the commissioner has said, but I think we've looked so many places, but we have not looked everywhere. We must begin to look at how to engage constructively with the community in the area of public health education. The point is that cholera is a disease that the driver is poverty. And as cholera is attempting to become endemic in Nigeria, it will rightly also be said that poverty has become endemic. And when poverty becomes endemic, as is the case now, cost of living very high, people eat anything, people drink anything just to stay alive. And that, of course, would make them vulnerable to infectious diseases like cholera. And when one person picks it, cholera is very fulminant and spreads fast. So it's a droplet infection, but then it's able to spread very, very fast because if you are attending to somebody who is beginning to present with symptoms of cholera, the likelihood that you that is managing that individual will come down with the disease is quite high. And so most times at community level, this information is not available. Information about how to process fresh food before they are consumed, particularly fruits and vegetables, are not a common conversation. We have issues with water, sanitation, and hygiene across the 36 states and the Federal Capital Territory largely. And so we need to address that. The issue of open defecation, insofar we have open defecation rampant and prevalent in Nigeria, we will keep having issues of recurrent and very persistent
and these are some of the things that the Lagos State government has also mentioned in terms of environmental hygiene. We'll see, some of the, now there is an effort, at coordinated response across the country by the NCDC. We'll see how that plays out. Thank you so much for your time. National President, Association of Medical Laboratory Scientists of Nigeria, and public health expert, Dr. Kasme Fine.
A pleasure.
Away from the cholera report to Rivers State, where supporters of former local government chairmen embarked on a peaceful protest across the state to rally support for the closure of the council secretariats by the police. None of the groups have been given access to the offices as the dispute over tenure elongation lingers.
Protesters marched from Azikiwe Road to Port Harcourt City Local Government Secretariat, but fierce-looking police officers prevented them from reaching the gate. For them, the police took the right decision to bar all access to the complex until the Court of Appeal gives its verdict on whether the elected chairman should continue in office.
They had asked us to stay clear from the council premises. We are staying clear, and they shouldn't allow any other person to gain entrance there. If not, we are resolute, we are also going to gain entrance there. And you know that won't be nice for all of us. So that's our message to them. They should keep to their word. They have said everybody should stay clear from the council premises. They should keep to their word.
Police is there to make us to have peace and to secure our properties also. So we want them to stay. We the women have come to say that police should stay until court decides otherwise.
The crowd also gathered in Obiakpo local government area to call on the police not to bow to pressure to vacate the council.
We are supporting what the police is doing. The matter is already in